Hello and welcome to this Facebook live session on smoke cessation. We are also putting this episode out as an audio podcast on our podcast called Hello Apollo. So thank you for joining us and thank you for making this grow in such large numbers. It is because of viewers and listeners like you that we are able to do this week on week and bring to you a specialist to give you credible health information on a subject that matters to you. And today is no different. I'm delighted to be joined by Dr. Rajesh Chawla, Senior Consultant, Respiratory, Critical Care and Sleep Medicine at Indraprastha Apollo Hospitals. Dr. Chawla, welcome to the podcast and Facebook session.
Hello, Dr. Karan.
So today, sir, we will be discussing a very important issue, which is smoking. और अगर आप स्मोक करते हैं और चाहते हैं कि आप स्मोकिंग की ये हैबिट छोड़ना चाहते हैं या छोड़ने की कोशिश कर रही है और नहीं कर पाए हैं, तो आज डॉक्टर चावला हमें समझाएंगे, बताएंगे ऐसे कौन से साधन हमारे पास अवेलेबल हैं, what are the means to actually quit smoking. But before that, I want to get into why tobacco and smoking is so bad. Dr. Chawla, I have with me statistics which say that 8 million people, as per the WHO, lose their lives every year because of tobacco use. And they also say that half of tobacco users die from its use. So it's a global problem. It's very serious. But I wanted to ask you, why is smoking and why is tobacco use so dangerous?
You see, tobacco, it's a habit forming. Anything you get into habit is bad. Even you eat a lot of sugar is bad. So similarly, smoking, because when you inhale, it goes directly into the lungs. And smoking, let's first talk about one of the form of tobacco is smoking. So it contains nicotine, which is a product which leads to the habit forming. Then it has the carbon monoxide and tar. These are the three very important, and majority of these smoke is by these. Then there are a lot of formaldehyde, arsenic, and about 4,000 products which are toxic. And many of them are toxic to health. So you inhale them, and then over the years, they cause not only the lung diseases, it causes other diseases also. Tobacco in any form is harmful, whether you chew tobacco, whether you take in a pan, whether canny or whichever form it is taken. Oral cancer, one of the common reason is the tobacco chewing, which has resulted in the cancer of the oral cavity, larynx, and all around that area. The tobacco or a cigarette smoking, it's harmful for health. That's why we are talking about, because, if you want to see from head to foot, it results in diseases and problems all over the body. People may have a stroke. Let's start from the brain. You can have a stroke and the vessels problem of the brain, which can result in stroke and other diseases. Then in the eyes, people have a lot of irritations like smoke, and it aggravates if you have already eye problem. Sinusitis in kids. If the parents smoke, there could be sinusitis. Similarly, there could be recurrent otitis media. That means in the ear, people who smoke, they can have a problem recurrent. And then I have already talked the cancer and you have all the time kharash hoti hai na jaise, all the time, and then it leads to husky voice, which people feel glamorous and they try to smoke all that because it's the inflammation, swelling repeatedly, which results in this. Then you go down, then in the heart, coronary artery disease. Then in the lungs, chronic obstructive lung disease. It also causes lung cancer, which is the commonest cancer which occurs because of why we are talking and why we are afraid, because people who are exposed to smoke repeatedly, the chances of developing lung cancers are very high. And similarly, when you go to the abdomen, all other diseases of the abdomen are also more in smokers. The diabetes is seen more in smokers. Then the vascular diseases, CA of the bladder, urinary bladder, that's also seen more in smokers. Then peripheral vascular disease. People have got amputation because of the peripheral vascular disease because of smoking. There are all these diseases on a repeated exposure to smoke and tobacco products results to these. So that's why we are talking about that tobacco is bad and it results in death. As Dr. Karan said, 8 million people die because of this smoke.
So, a lot of people have this that they may not be chain smokers or maybe heavy smokers. They only smoke very little. Is any amount of tobacco use safe?
No, there is nothing like this. If a person smokes 20 or 10 cigarettes a day and the other smokes only 1 cigarette a day, the coronary artery disease, the risk would be almost half. But still it would be there. No smoke is safe. So you should not smoke even a cigarette. Some people say, "मैं खाना खाता हूँ उसके बाद पीता हूँ," but that is also harmful. So there is nothing like that. Less amount is totally safe. It may have a less effect, but it does have a harmful effect.
Right. And before we get to cessation, I also wanted to understand, and for the benefit of people who are listening to us and watching us, which part of the smoke that is generated, जैसे आपने बताया, carbon monoxide, nicotine, and the delivery system causing harm, which part of it is the addictive part, which is the reason why
I think everyone knows that it is the nicotine.
Right.
Nicotine is what leads to the addiction and which leads to the craving. And when the amount of nicotine in your blood goes down, and then you have a craving, and the more cigarette you get addicted to, the more craving is there. So nicotine is responsible. So that's why when you quit, you have things which give nicotine. So it is nicotine. The answer to your question is it is nicotine.
Right. And you touched upon this briefly, but I just want you to spend some time on this, is on smokeless tobacco. A lot of conversation goes in the smoking of tobacco, but could you throw some light on the harmful effects of chewing tobacco as well?
As I said, the cancer.
Right.
Of course, your oral hygiene is very bad, which can lead to dental problems, infections, and the cancers of all the parts of the oral cavity. Oropharynx are much higher in people who chew tobacco in some other form. So that is the main side effect of chewing tobacco. Of course, that is also habit forming. And dental problem, which can lead to chest infections and all sorts of problems, particularly people who are smoking and they have tobacco in them, they inhale and land up with infections and pneumonias.
Right. And since we're just coming out of COVID, and as I think most of this country knows, you were at the forefront of leading that battle against COVID. For patients who had COVID or people who have had COVID and they are also smokers, is there an additional risk for them?
See, a normal lung, of course, will have an impact. Person who had COVID, who's been on oxygen, whose lung is spoiled by the COVID, naturally the effect of smoking is only going to add to the already deranged functions. The good thing about COVID was that once a patient normalized, most of the other lung remodeled and the x-rays were looking normal, CTs were looking normal, but their oxygenation, which we test by diffusion, was less. So all these patients, many of them have these problems, and when they're exposed to these smoke, this will also have an impact and it will hasten the problem in them. So they should also not smoke cigarettes or BD. The other thing is, some people think that BD ka nuksan nahi hota, hookah ka nuksan nahi hota. One session of hookah is almost equal to 20 cigarettes because they take more than an hour when they sit in Chopal and have hookah or sit in a party and have hookah. So if you smoke for 1 hour, almost you smoke 15-20 cigarettes. Right. So it is not, and BD is as harmful. So all smokes, whether it's a cigarette, BD or hookah, they're all harmful. No form of tobacco you consume by these methods is harmless. They're all harmful.
Right. And so before we come to the solution, I just wanted to ask you also on things like e-cigarettes, which were actually projected to be solutions for people to leave or quit smoking. What is now the research and the literature saying about the harmful effects of e-cigarettes themselves?
See, e-cigarettes are also harmful and they have a different type of side effects, and there is don't get into the impression that if you get an e-cigarettes, and that is the reason the government has banned e-cigarettes, vaping, any form of these is harmful. So you should not get into that e-cigarettes are not, that is the reason that they have been banned from India.
Right. I think that was a very progressive step taken very early on by the government of India. So, sir, let's now talk about solutions. So we know the habit is bad. It's in fact lethal, as you've very beautifully laid out what harm it causes to the entire body, all organs. If you talk about solutions, now if somebody wants to quit, how should they approach it? I know in your clinic, a lot of people would come and say, we want to leave smoking. How should they approach this?
When you get into smoking, first of all, you get into smoking because your parents are smoking, the family brothers are smoking, in the office your friends are smoking, peer pressures, the girls are smoking, the boy wants to show them that they are not less, they will peer pressure, they will smoke, misinformation, little pleasure, and then they get into this habit of smoking. Now, knowing fully well by the media and in their subjects that smoking is harmful. Every cigarette packet has written smoking is injurious to health, and I don't think any of the smoker reads. In spite of knowing he is so used to that line that it doesn't make a difference to him. So once you decide, this smoking cessation is a better word, we call it smoking quitting. It's a process of quitting smoking. There are various ways, and it involves the determination, motivation, the behavioral therapy, counseling, and some replacements which can help in quitting smoking. So if you really want to quit smoking, first you have to be motivated. And the family can help during that period when the person decides to quit smoking, because I feel quitting smoking is easiest out of all the drugs. Because if you want to really quit smoking, one thing I have realized that it is the motivation of the person which is the most important, and the motivation by the family and friends. Because the problem is the friends, they only put you into this. So the friends, the family, everybody has to motivate. Then sometime you can decide a quit date that I'm going to this, and you start working that now I'm going to quit. It sort of puts a little target to you that you're going to quit. It's like an occasion and you look forward to that. And you set up a date, and then you decide that you are not going to smoke that day. And then, when you decide to stop quitting, there is nothing like I'll reduce the number. You can never come out. It has to be clean cut. Just stop it. And you could get some withdrawal symptoms. You could get irritated. You may get headache. You may get constipation. And some people, they feel that they are having a little cough. And the family has to support in that period. Bear them. Because this is, if they are shouting, if they are getting irritated, just support them during that period. And if the symptoms of craving are too much, then the nicotine replacement therapy. The people who this is not working, then they can take these, they are gums, patches, sprays, various form of nicotine, and you should take the minimal amount which avoids craving in you. Then there are some pharmacotherapy also, vernaculine and buprenorphine. These are also drugs. But what we've seen is the motivation, and these 80% of the people are able to use. It's the heavy smokers who require drugs, and then you have to have a history. Don't take like that. Take with the consultation of the doctor. These have side effects, particularly patients with liver disease or some history of seizures. They need to be careful about these pharmacotherapy. So it should be done under the supervision of a physician. So, and the family has to support during that time. If you really want to chew something, you can take a elaichi or something in your mouth, or a candy in your mouth. Do exercise during that period. Go for a walk. All these things, and I can tell you 7 to 10 days, and you're off the cigarettes. And then the most important time comes when you should, if you are a friend of a person who started that he's not going to smoke, you need to support him. Do not put pressure on him that he's done a good job. So don't put pressure that you have one fag and it is not going to make a difference. Don't do that. So the family, friends, everybody has to support, and then you can take a medical help in the form of a counseling, which will counsel you so that you remain there and you are able to quit.
Right. So, like you said, there are various interventions, but motivation being the most important and commitment to it. Also that, it's important that people should not self-medicate on these new medications that are available only under strict guidance of a physician. There is also a question about these, the nicotine replacement therapies. Are they safe by and large if people use them over, say, 3-6 months or 1 year as
they are pretty safe? The only problem is some people get addicted to them. They have left cigarette and they get addicted to them. So you should take the minimum, whether you take gum, patches, lozenges, taken in a small amount under supervision, they're quite safe. But do not just stick on to, then you have to leave them as well and take the minimum possible dose. So always remember, nothing is safe. If you can do without it, that is the best. But if you can't do, then probably take the minimal amount of these drugs which are helpful.
Right. And
there are helplines also. I don't know whether your people are aware or not. There is a smoking helpline. This number is there on every packet. Yeah. The Smoke You Smoke. It is in Patel Institute, and they have. I visited that place. There are 40 people sitting who will counsel you, who will help you also in quitting smoking. So that you can take the help of the helpline also, and they will award you also if you quit smoking. That's also there. But you need to see your pack. It is written there, the helpline number.
Right. So the solution is also there in the problem that you have in your hands. So very empowering message. So could you share with us one or two examples that you would have seen in your vast experience of work where actually heavy smokers, after your advice or intervention, have successfully quit?
I mean, not one, not many. But I tell you, as a doctor, when they come to me with some disease, when they get admitted or something, that is the best time to ask them. That is where they want to listen, and that is the best time because they're in a hospital, they can't smoke. So, and they are anyway quitting smoking, and we can help them during that period. I have seen that is the best time. But of course, a healthy man who's been smoking can also. And I have n number of examples. But unfortunately, not many people come forward just for smoking cessation. They will come for something else, come for a persistent cough, come for a still sputum, and then I counsel them and tell them that you quit smoking, and then they have been able to quit smoke. And whenever you quit smoking, there are little challenges which I said, the craving, the fight inside you to have this thing. Everyone has a different triggers, so try to take the help of family or friends, talk to them, and somehow get over that period, and then you'll be able to quit.
Right. And, this medium actually goes out to a lot of young people out there. What message would you have for them, sir, who might be thinking about it or may have just started smoking or using tobacco?
You see, first of all, you should not get into this. There are other ways to enjoy. So it doesn't make you glamorous. For a little while, you may look good that you are giving company to your girlfriend, to your boyfriend. But in the long run, it's going to harm your body. And it will have impact on any organ it can impact, and then it's difficult to leave. So better not go there. And that is the easiest way. And it is not very difficult. And if you tell your friend that, no, I have decided I'm not going to smoke, and please don't. And be in the company of friends who do not compel you. Because after all, it's your health, your body, and you have to take care of it. So don't get into this. That is the best message I would like. And if you already got into this and try what I said, not very difficult for you guys to leave it. And this is the age, if you are young, just leave it. Not only avoid the side effect of this drug, but also not getting into this deep well of addiction and then difficult to get out of this.
So thank you so much for joining us on this conversation and for that uplifting and encouraging message. And to our listeners and viewers, if you do need to seek professional help, as Sir said, it is right there on the packet. But if not, there are other mediums, as he's laid out, a whole range of things, but motivation being the most important. And if you do want to come in and consult with Dr. Chawla, the ticker below has all the information. Please do reach out to us. If you're listening to us on the podcast, please send us a direct message on our social media platforms. We'll be very glad to set up an appointment with Sir. And we do hope that as you start this journey of quitting, you have enough motivation and willpower, and there will be support from providers like us to help you on that journey. And thank you so much for joining us for this session. Till next week, stay happy and healthy. Thank you.